I'm so excited to have Dr. Melissa Wittman with us. Dr. Wittman is a chiropractor specializing in functional neurology and functional medicine. She's also a mindfulness advocate and nutrition and herbal medicine enthusiast. Dr. Wittman, it's great to see you.
So good to see you. It's awesome to be on here.
So, can you share a little bit about your background and what brought you to learn functional neurology?
Yeah, I can. So in 2010, I was in school, and that is when I learned about functional neurology. Professor Ted Carrick came and spoke on a Friday night. If that tells you anything about me, that's what I was doing on Friday night, listening to him speak. And I knew that that was it for me. This is the road that I wanted to go within my career. And so while I was in school, I went through the diplomate program in functional neurology. And through that, that's a really incredible field, but I felt like there was almost something missing. Some patients would get better, some wouldn't. And I would say, why aren't this subgroup of patients getting better? And that's what led me to really dig into all of the primitive reflex work and everything that's more of the developmental functional neurology component of it that I practice now.
Uh-huh. And what is the role of nutrition and how it affects child development? And if you can speak a little bit why you think that many parents first dive into the nutrition part before learning about primitive reflexes and functional development.
Mm, that's a good question. I think in general, the nutrition component is just more well known. I think it simply has more publicity or more parents have talked about it. It's also a little bit more accessible. So if someone says, hey, try this food or cut this out, that is typically more accessible than learning what are primitive reflexes, how do I test them, what do I do? I know that can be really daunting for these parents who are already exhausted. But for the role of nutrition for anyone for brain health, it's imperative. I mean, it's incredibly important. But the difficulty, the thing we run into with these kiddos is the picky eating and only wanting to eat certain things, and even being really sensitive to tastes of certain supplements. That can be a difficulty. So that's part of when you're working with parents, maneuvering and brainstorming and helping them through how they can best help their child. So it really can't be a one size fits all and just say, take this, do this, because every one of these kiddos is different.
Mm-hmm. So would you suggest that it's better starting with primitive reflexes and maybe after working on it a bit, all the eating habits may improve?
It is a little bit of a chicken and an egg, but I do have an opinion that I've developed just clinically doing this for over a decade, that I think a really important place to start is actually nervous system regulation. I think that's a crucial place to start, even as you're working on primitive reflexes or nutrition. No matter what nutrition you're putting in, if this kiddo is absolutely in fight or flight, how much of it are they actually going to digest or get the benefit from this nutrition? And if you're doing primitive reflex work, and again, they are absolutely freaking out, how much benefit are you going to get? Their body needs to be in a state that they're receptive to healing and in a state where they can change their brain and they can create the neuroplasticity that we're asking it to make.
Mm-hmm. And why do so many of these kids struggle with gut issues?
Yes. So, I mean, part of it is this nervous system regulation. All of us, right? We've been nervous and you feel your stomach is nervous. And we know that the ideal state to be in most of the time is that rest and digest state. When you get out of that into the sympathetic and you're affecting vagal tone, you're affecting your ability to digest food and to have all of the right things in place to get what you need out of the food you're eating. And then sometimes they have gut issues because the foods that they're really picky about eating actually are causing issues as well.
Mm-hmm. So, as a rule, should we avoid eating gluten and dairy-free for these kids?
So early on in practice, I would have said yes, absolutely. But I'm also a mom of two kids. And so there has to be grace in this as the practitioner. Again, this is a very individualized thing. Some kiddos are like, I don't care, I'll eat anything. And with some, if you were to remove dairy and gluten, they're really not going to eat. And especially when you're talking about neurodivergent kiddos or autistic kiddos, the typical paradigm of, oh, they'll eat when they finally get hungry doesn't always apply. It could be that they're not feeling their body. They're not feeling that they're hungry. Or it could be that they really truly have that much of a sensitivity, issues with texture and stuff that they just simply won't eat. Then you get into the whole realm of blood sugar dysregulation, which these kiddos are already sensitive to, and can really become a nightmare as the caregiver if they're going through blood sugar fluctuations. And that's where parents will be like, I just have to give them this food. So ideally, would it be removed? Yes, but then that's a conversation. So in my office, that's a conversation that I have with these parents of, okay, can we switch to a traditional sourdough? Right? So we're removing gluten, yes, but we're not just pulling everything off of this kid and having them basically have no grains when maybe they eat sandwiches all day. And then when it comes to dairy, dairy is not usually as big of an issue with these kiddos, but can we switch to raw milk if they really need milk? How do they react to it? Some people just simply can't do it, and some do great with it. Or the A2 milk. That's something that is becoming much more accessible, like an A2 grass-fed milk is a really beautiful option for people who can handle it. And that's something that, again, goes with each kiddo. And a piece to remember is that we're not always looking for digestive upset. Maybe they do have digestive things, but it could be an increase in anxiety, especially with gluten. Is it an increase in anxiety? Is it a change in behavior? Are they suddenly really fatigued if they eat a bunch of gluten? These are all important pieces to look at, not just a digestive component.
Mm-hmm. And what is actually the difference between food intolerance and food sensitivity?
Mm-hmm. So food sensitivity, you're having an immune response to it. So that could be not a full allergy response, but you might have a rash, you might have a headache, fatigue. You're having some kind of immune reaction to a food. And intolerance is typically just a gastrointestinal issue. So it's just a digestive issue that you're seeing.
And how often would you advise to do these testings?
To do like a food allergy testing or a gut panel testing?
Yes.
Those. Once we do it, we typically say to retest in about 6 months from implementing whatever the protocol is. That's just a general rule of thumb.
Mm-hmm. And how can parents actually ensure the children are getting a balanced diet?
I think I'd be like the queen of the world if I had the answer for that. Oh my gosh. Let me talk about that as a mom for right now. Okay.
Okay.
So my oldest, I have a 7-year-old and a 5.5-year-old, and they're very different. I have a left brainer and I have a right brainer. So for those of you who are familiar with that, okay. So I have one who is more on the spectrum, but will take any herb I give him, no issues whatsoever. I've done it since he was little. The right brainer is, more chill, but sensitive, doesn't want to take anything. It will literally has spit methylene blue back at me. And if you've used blue, oh, the mess of that, okay? So it's finding a balance of not completely stressing them out or stressing me out. Because again, what my clinical experience, mothering experience, research experience has brought me to is really that importance of nervous system regulation. So again, if I am stressing out, you have to take these supplements, and they're like, taking them, what benefit are they fully getting of that? Versus if I can, so a few of the things I've discovered is applesauce is amazing, apple butter is amazing. Those will cover a lot of things. So if your kiddo doesn't like to take it in liquid, wants more of a spoonful of something, classically, I used to say honey. A lot of kids will take stuff in honey. Some kids don't like the texture of honey. So using applesauce, apple butter covers a lot. Then I also make smoothie popsicles. So I'll get the silicone popsicle molds, if you've seen those. And I will actually dose out their supplements I'll make the smoothie, put enough in there. So if I'm making 12 popsicles, I'm making like 12 doses of whatever it is. If I'm putting the binder, CT minerals, fatty 15, whatever I'm putting in. And then this isn't, again, that's why I'm saying this as a mom. Okay, this isn't a perfect science. Then I will pour those molds and they're getting about a full dose. Obviously make sure you stir it really well as you're pouring it in to try to keep it even. And then they'll eat one of those popsicles. Like I make a smoothie with banana and raspberry and things that I know they like. I'll often put a protein powder in it, so they're getting protein as well. Again, looking at blood sugar regulation. That's an important component. And then if there's something, a lot of kids that I've seen over the years will eat spaghetti, they'll eat something with red sauce, like beef organs and different things, the dried capsules mix really well into that red sauce. That's another thing you can do. Open up those capsules, put them in red sauce, and they're really pretty much undetectable in there. But as your child's nervous system regulates and they're not perceiving everything as a threat, new foods are not as concerning. As you're working on primitive reflexes and they feel their face better and they're not having this strong rooting reflex, new foods are not as big of a deal. All of these things do go together, but sometimes where to start can be the most difficult thing.
Yeah. And many of the kids who you see are nonverbal. And I know in the clinic you work a lot on the trigeminal nerve. Can you explain how can that actually help?
With speech?
Yes.
Sure. So when we're working with the trigeminal nerve, we're also working the rooting reflex. So through here, we're working on the rooting reflex. But when we're working trigeminal nerve, we are helping to bring more blood flow and oxygen to the brainstem. And building up the brainstem, working through each of those parts of the brainstem is the foundation of developmental functional neurology, and working and helping a child get through that developmental process, and then we can get into the cortex. So it's more of rooting reflex, helping the brainstem. We also work a lot on the tongue. So stimulation on the tongue is a huge component of that. So trigeminal nerve, yes, but it's usually, we'll say trigeminal and tongue.
So we're not waiting for all of the reflexes to integrate. We're doing it at the same time, right?
Yes.
And sorry, you go.
And we'll often see progress. It's not always the end goal. Of course, we want these reflexes to integrate, and anyone listening probably knows what that means. But these, just in case someone doesn't, these reflexes don't go away. They're inhibited. So the frontal lobe kicks on and says, this brainstem and this child is mature enough. We don't need these reflexes right now. We're going to inhibit them. When we see them come back is when we're having an issue that could be an emotional trauma, a physical trauma, head trauma, something. We'll see the returned reflexes. So that's something to keep in mind too, because I'll have parents come in and say, oh my gosh, that rooting reflex was integrated and now it's back. What happened? And I'll say, oh, okay. Were they sick? Did they hit their head? Well, yeah, they fell off the slide. Okay. So they don't just go away. So if you see them come back, it's a great indicator of where they're at, but don't freak out like all your hard work is for nothing. Yeah.
And we mentioned anxiety. So how can vagal stimulation help?
With anxiety and nervous system regulation?
Yes.
Yeah. So when you're looking at, we have the ventral vagal, that's the calm, rest and digest. You feel like socializing, you feel good. Then you have spinal sympathetic, that's like the classic fight or flight. And then you have dorsal vagal, and that's the shutdown, the freeze. And these kiddos will sometimes bounce between the two. You'll see that they're maybe more outgoing, but it's in a dysregulated way. And then they'll get really fatigued or really withdrawn or go into their own world and kind of go between those two. And we're working them, and that's just a process in the brain as well, working them to be in that ventral vagal state. And all of us want to be in that state, but we don't live there. We want to be able to go into sympathetic, the spinal sympathetic, or go into, I don't know about going to dorsal vagal, but that we can have some fluctuation within that. And the key is that our system knows how to go back to the rest and digest, and that it does that with ease. That's really what we're training, that it can get back to that state with ease. So when we talk about doing vagal stimulation, whether we're using sympaconcha for the auricular branch of the vagus nerve, whether we're working more through like the motor branch here, breathing, whatever it is, we're really bringing them closer to that ventrovagal state.
And we mentioned briefly mindfulness. Do you incorporate it in your sessions?
Yes, but in full transparency, the cases we see in our clinic are not always cases that are, they're not going to sit down and have mindfulness. Some of them are minimally conscious. Some of them are very severe autism cases, very severe brain trauma. So, where I'll use it more is on the caregiver or the parent, kind of help talk them through that. But on kiddos who are, if you're at home watching this, or you have someone under your care that is able to do it, a really simple way to incorporate mindfulness, and I do this to some extent, is you just have them focus on the task at hand. And that has so many benefits, but that's a really simple mindfulness tool. It's great for the brain. It's great for, even eye movements, right? Keep your eyes steady, fixed on something. There's a ton of benefits. So that's a really beautiful way to just help everyone slow down. The other thing, again, is slowing down, to do everything at a slower pace, even slower than what's comfortable. Slow everything down, slow your movement, slow your speech. So when a kiddo is really ramping up, I will go even slower, and I will talk even slower, and I will move even slower. And instead of matching their pace, I am bringing them down. I'm showing them it's safe. I'm calm. You can be calm too. And it doesn't always show up in that moment. I'm not saying they're going to be like, oh yeah, super calm, but it's a dance that goes on between, whether it's myself and the patient or the caregiver and the patient. You're building that over time.
And what would your advice be about how to teach breathing techniques?
Yeah, like how to help kiddos with breath work.
Yes.
So there's a couple different things. If they're more visual, like the Calm app, or probably even on YouTube, there's the things that you can watch, and it'd be like a circle that gets bigger and smaller, or something that moves. And so you're inhale, exhale, inhale, exhale. Those are really good visuals. They're really good for eye movements too. I will use them, some of the ones that you have to watch is really good for eye movements. That's a really good one. You can blow up balloons. So we'll have kiddos, even if they can't do it, just trying to blow up a balloon is a very vagal type. It will help stimulate the vagal system. That's not as much of a breathing technique. I've seen kiddos do it where, they're inhaling like this and then exhaling. You want the exhale to be longer. So whatever the inhale is, the exhale is longer. They can kind of watch their fingers. And so they're paying attention to their own body. That's a really good one. Those are probably the simplest, most effective ones that I can think of off the top of my head.
And in terms of teaching a child meditation, do you have any tips?
Honestly, my best tip is to model it, to have them see you doing it, even if it's just a couple minutes. It's not as much now, but when my kids were little, they would sit down on my yoga mat and close their eyes and tell me they're meditating because they had watched me do it. Now they're at an age where they're kind of more doing their own thing. But if my yoga mat's out, they'll still sit on it and close their eyes. And that's really cool because I didn't really sit, I'd never made them like sit with me and do it. That's a cool thing. So for sure, modeling it, and then you're going to get benefit out of it too, which is amazing. There are so many apps, and probably ones that I've never even heard of, that are specifically for kids and mindfulness, meditation. I've used the Calm app. I mean, over 10 years, I've had the Calm app. Like, I don't want to let my subscription go because it's at such a, like low price because I've been using it for so long, but they have a bunch of stuff in there for kids as well. And these kiddos who are used to using technology, you can do that too.
Yeah, I think the bed in your office is great. The
Oh
one,
my gosh, the sound
yes,
bed.
it sounded.
Yes, yes. And so for those who don't know a sound bed, there's a couple different manufacturers, but basically you're laying on a small bed, or some of the brands are massage tables, something along those lines. You have headphones on and it's playing frequencies, it's playing some sort of music, and you're feeling the same thing you're hearing. And it can be a really spiritual experience too. Kind of the intention you go with, you'll get out of it, but it is incredibly relaxing. It gets you in your body and it connects what you're feeling with what you're hearing. So it helps your brain connect with your body. It's giving that spinal stimulation. So good. So good. The world would be a different place if everyone did that on a regular basis. Yeah.
Exactly. And Dr. Wittman, how can people contact you?
I would say Instagram, Dr. Wittman, DrWittman.
Uh-huh.
Yeah.
And a short word about your podcast?
I do. I have a podcast called The Autistic Female. I haven't recorded anything there in a while. I'm in a bit of a transition personally and with what I'm doing kind of for my hobby stuff. But those episodes are there. There's some good stuff for anyone who wants to get more into that. I always say if you have an autistic kiddo, sometimes the parents have traits as well, especially the mom. And doesn't matter what the label is. Some people don't want a label. It's completely fine. But if it's something that's going to help you make sense of your life, of your childhood, and of how you can better help yourself, that's always a good thing.
Thank you so much.
You're so welcome.